With daily COVID-19 cases at record highs in recent days, GP clinics and private medical providers are seeing a surge in the number of patients coming in for swab tests. They include those who have tested positive on antigen rapid tests, as well as those who have received COVID-19 health risk warnings or alerts. But to prevent any infection spreading within the clinics, GPs told the Straits Times that anyone who tested positive in their self-test will be prioritized. Last Friday, the COVID-19 task force urged people with mild acute respiratory infection symptoms to avoid going to hospitals' A&E departments, which are coming under pressure. MOH said yesterday that more hospital beds are being diverted to COVID-19 cases. But when the current situation has stabilised, 10 to 15% of COVID-19 patients are expected to need hospital care. That's according to Singapore's Director of Medical Services, Associate Professor Prof Mak, whom my colleague journalist Cheryl Tan spoke to yesterday. Cheryl joins me now. Welcome to the show, Cheryl. As we transition to endemicity, what did Prof Mak say about managing COVID-19 patients so that hospitals don't become overwhelmed?
So Prof Mak yesterday said that, now that home recovery will be the default care option, especially for those who are aged 12 to 69 and have mild to no symptoms. He expects that around 50% of the patients will be able to recover at home. So all of those who are infected but are unable to isolate themselves safely, such as, if they have common facilities with their family members, then they will have to be placed in community care facilities. And on Sunday, MOH also introduced a new category of community care facilities. And this enhanced version will cater to those who are at risk of deterioration, such as elderly and those with multiple illnesses. So around 30% of this group of people will actually recover from CCFs. So that leaves us with the remaining maybe 10 to 15% who have severe illness from getting infected, and they will be admitted to the hospitals. So with this, we won't expect hospitals to continue being overwhelmed, and can then ensure a standard level of care to be given to these patients.
Cheryl, given the introduction of self-isolation and home recovery, does that mean Singapore is not prioritizing the prevention of the spread of infection?
No, actually. So Prof Mak yesterday said that the basic tenets of preventing spread is still there, especially because there are unvaccinated people who can get seriously ill, require the ICU, or possibly die from the disease. It's just that the responsibility has now shifted from the government to the individual. So people are now required to take a lot more personal and social responsibility in self-isolating and preventing transmission.
Thank you so much, Cheryl, for the sharing. That was Cheryl Tan, journalist for the Straits Times.